là, je vous vois. Parfait. OK. Donc, je vais faire transférer la ligne, puis opérateur, si vous voulez transférer la ligne, et la modératrice, je me souviens plus de votre nom. Si vous voulez... Ouais, attendez après la fin de la musique, je dirais 5 secondes, et puis vous pouvez commencer.
Merci.
Perfect. So everything that you say from this moment on can be heard in the conference. Please stand by.
This conference is being recorded. Cette conférence est enregistrée.
Hello, everyone. Bonjour à tous. Welcome, and thank you for participating in today's technical briefing, which will provide an update on the COVID-19 vaccine rollout in Canada. Bienvenue au brefage technique afin de donner une mise à jour sur la distribution des vaccins contre la COVID-19 au Canada. Today, we will hear remarks from Dr. Howard Njoo and Major General Danny Fortin from the Public Health Agency of Canada, and from Dr. Tom Wong, Chief Medical Officer of Public Health, Indigenous Services Canada. They will be accompanied by Joël Paquette from Public Services and Procurement Canada to answer questions. Aujourd'hui, nous entendrons des allocutions de Dr. Howard Njoo et Major Général Danny Fortin de l'Agence de la santé publique du Canada et du Dr. Tom Wong, médecin en chef de la santé publique des services aux Autochtones Canada. Ils seront accompagnés par Joël Paquette de Services publics et Approvisionnement Canada pour la période de questions. Following the remarks, we will open the teleconference line for questions from the media. Suite à la présentation, nous répondrons à vos questions. If you wish to ask a question, please press *1 on your phone. Si vous désirez poser une question, veuillez appuyer sur étoile 1. Procédons à la séance d'information technique. Let's begin today's technical briefing. Over to you, Dr. Njoo.
Thank you, merci. Hello, everyone, and thank you for joining us at today's technical briefing on Canada's COVID-19 vaccine rollout. I'm here with Major General Danny Fortin, Vice President of Operations and Logistics at the Public Health Agency of Canada, as well as Dr. Tom Wong, Chief Medical Officer of Public Health, Indigenous Services Canada. We will each provide brief remarks and then open the floor to questions. To assist us in answering your questions, we have with us Joël Paquette from Public Services and Procurement Canada. Increasing numbers of Canadians are getting their vaccines. As of today, more than 13 million COVID-19 vaccines have been administered in Canada. Of them, more than 2 million people have received their shot during the last week. As of last Saturday, more than 36% of the adult population in Canada has received one dose of the vaccine. Among people 80 years of age or over, 88% have received their first dose and 16% have received their second. And among people 70 to 79 years of age, 84% have received their first dose and 5% have received their second. In younger groups, 61% of those aged 60 to 69 years and 35% of those aged 50 to 59 have received their first dose. In all three territories combined, almost 71% of adults over the age of 18 have received at least one dose of COVID-19 vaccine, and 59% have received their second dose. This high vaccine uptake, coupled with strong public health measures, has contributed to a steady decline in active cases within the territories. In Quebec and Saskatchewan, almost 40% of adults have received at least one dose so far. Nova Scotia and Manitoba have vaccinated more than 6% of their population in just 1 week. We are pleased to see this uptake in all of our provinces and territories. As of April 23rd, there have been 4,128 reports of adverse events following immunization to date. These include any medical event that occurs following immunization, but isn't necessarily related to the vaccine. 617 of these reports, about 1 in 19,000 doses administered, were considered serious, such as a severe allergic reaction. As of April 23rd, there have been 7 cases of blood clots with low platelets following receipt of AstraZeneca vaccine in Canada, reported to the federal level. Sadly, one of these cases, reported from Quebec, is a person who has passed away. We offer our sincerest condolences to her family and friends. Health Canada and the Public Health Agency of Canada are gathering additional information on this case and will consider the details as part of the ongoing monitoring of risks following immunization with the AstraZeneca vaccine. The rate of this adverse event is most commonly estimated to be between 1 in 100,000 and 1 in 250,000 doses administered, but it could be lower or higher than that. Following reports of very rare adverse events related to blood clots with low platelets after the receipt of the Janssen vaccine in the United States, Health Canada conducted a thorough, independent assessment of all available scientific data and has now concluded that these events may be linked to the use of the vaccine. However, the regulator has determined that the benefits of the vaccine continue to outweigh the risks. This is in line with the findings of other regulators, including the U.S. Food and Drug Administration and the European Medicines Agency. As a result, Health Canada has worked with Janssen to update its vaccine product label regarding this rare event and to provide the necessary information to healthcare professionals and vaccine recipients on the signs and symptoms to watch for, as well as available treatment guidelines. The Public Health Agency of Canada and Health Canada continue to monitor the safety and efficacy of all authorized COVID-19 vaccines in collaboration with provinces and territories, the manufacturers, and international partners. The system is working, and we are committed to ongoing transparency and providing Canadians with the information they need to make informed decisions. This week is National Immunization Awareness Week, an opportunity to celebrate and acknowledge the importance of vaccination. The timing for this is significant as COVID-19 vaccines become increasingly accessible to a growing proportion of the population. And some provinces and territories are also focusing their vaccination efforts to reach at-risk communities and hotspots. I want to also take this opportunity to remind Canadians that, regardless of their vaccination status, they should continue following public health measures even as we begin to see the positive impact of the vaccines. Since January, we have seen a decline in COVID-19 incidence rates among adults 80 years or older, a promising trend related to the fact that the majority of individuals in this group has received one dose of a COVID-19 vaccine, and many have received both doses. There are currently multiple initiatives underway to mark National Immunization Awareness Week. Earlier today, the Public Health Agency of Canada announced funding for 2 projects through the Immunization Partnership Fund to address vaccine confidence. One is a project from the Canadian Association of Science Centers called #ScienceUpFirst, which aims to debunk misinformation and reach vulnerable populations with culturally relevant and scientifically accurate COVID-19 information. The University of Toronto leads the second project, known as CARD, which aims to facilitate a more comfortable vaccination experience by introducing proven pain management techniques to address needle fear. These innovative projects are helping to ensure Canadians have access to reliable information on COVID-19 vaccines and vaccination. Our partnership with Uber, announced last week, is also expanding access to critical information. To support increased vaccine uptake, the #MyWhy campaign, launched earlier this month, will continue throughout the vaccination rollout. The campaign asks people what's motivating them to get the COVID-19 vaccine and to share their reasons on their social media channels. I encourage people everywhere in Canada to take part in this initiative. Your story may compel someone else to get vaccinated and share their story, further protecting our communities and spreading the word about the importance of vaccination. If you still have questions about the COVID-19 vaccines, don't wait. Turn to a trusted source, such as your healthcare provider, so you can make an informed decision about getting vaccinated when your turn comes, which may be very soon. Thank you. Bonjour tout le monde. Merci de vous joindre à nous aujourd'hui pour cette séance.
Hello, everyone, and thank you for joining us today at the technical briefing on Canada's COVID-19 vaccine rollout. I'm here with Major General Denis Fortin, Vice President of Operations and Logistics at the Public Health Agency of Canada, as well as Dr. Tom Wong, Chief Medical Officer of Public Health at Indigenous Services Canada. We will each provide brief remarks and then open the floor to questions. To assist us in answering your questions, we have with us Joël Paquette from Public Services and Procurement Canada. Increasing numbers of Canadians are getting their vaccines. As of today, more than 13 million COVID-19 vaccines have been administered in Canada. Of them, more than 2 million people have received their shot during the last week. As of last Saturday, more than 36% of the Canadian adult population has received one dose of the vaccine. Among people 80 years of age or over, 88% have received their first dose and 16% have received their second. And among people 70 to 79 years of age, 84% have received their first dose and 5% have received their second. In younger groups, 61% of those aged 60 to 69 years and 35% of those aged 50 to 59 have received their first dose. In all three territories combined, almost 71% of adults over the age of 18 have received at least one dose of COVID-19 vaccine, and 59% have received their second dose. This high vaccine uptake, coupled with strong public health measures, has contributed to a steady decline in active cases within the territories. In Quebec and Saskatchewan, almost 40% of adults have received at least one dose so far. Nova Scotia and Manitoba have vaccinated more than 6% of their population in just 1 week. We are pleased to see this uptake in all of our provinces and territories. As of April 23rd, there have been 4,128 reports of adverse events following immunization to date. These include any medical event that occurs following immunization but isn't necessarily related to the vaccine. 617 of these reports, that's about 1 in 19,000 doses administered, were considered serious, such as a severe allergic reaction. As of April 23rd, there have been 7 cases of blood clots with low platelets following receipt of AstraZeneca vaccine in Canada, and these 7 cases were reported to the federal level. Sadly, one of these cases, reported from Quebec, is a person who has passed away. We offer our sincerest condolences to her family and friends. Health Canada and the Public Health Agency of Canada are gathering additional information on this case and will consider the details as part of ongoing monitoring of risks following immunization with the AstraZeneca vaccine. The rate of this adverse event is most commonly estimated to be between 1 in 100,000 and 1 in 250,000 doses administered, but could be lower or higher than that. Following reports of very rare adverse events related to blood clots with low platelets after the receipt of the Janssen vaccine in the U.S., Health Canada conducted a thorough, independent assessment of all available scientific data and has now concluded that these events may be linked to the use of the vaccine. However, the regulator has determined that the benefits of the vaccine continue to outweigh the risks. This is in line with the findings of other regulators, including the U.S. Food and Drug Administration and the European Medicines Agency. As a result, Health Canada has worked with Janssen to update its vaccine product label regarding this rare event and to provide the necessary information to healthcare professionals and vaccine recipients on the signs and symptoms to watch for, as well as the available treatment guidelines. The Public Health Agency of Canada and Health Canada continue to monitor the safety and efficacy of all authorized COVID-19 vaccines, working in collaboration with provinces and territories, the manufacturers, and international partners. The system is working, and we are committed to ongoing transparency and providing Canadians with the information they need to make informed decisions. This week is National Immunization Awareness Week, an opportunity to celebrate and acknowledge the importance of vaccination. The timing for this is significant, as COVID-19 vaccines have become increasingly accessible to a growing proportion of the population. Some provinces and territories are also focusing their vaccination efforts to reach at-risk communities and hotspots. I also want to take this opportunity to remind Canadians that, regardless of their vaccination status, they should continue following public health measures, even as we are beginning to see the positive impact of vaccines. Since January, we've seen a decline in COVID-19 incidence rates among adults 80 years or older. This is a promising trend related to the fact that the majority of individuals in this group has received one dose of a COVID-19 vaccine, and many have received both doses. There are currently multiple initiatives underway to mark National Immunization Awareness Week. Earlier today, the Public Health Agency of Canada announced funding for 2 projects through the Immunization Partner Fund to address vaccine confidence. One is a project from the Canadian Association of Science Centres called #ScienceUpFirst, which aims to debunk misinformation and reach vulnerable populations with culturally relevant and scientifically accurate COVID-19 information. The University of Toronto leads the second project, known as CARD. It aims to facilitate a more comfortable vaccination experience by introducing proven pain management techniques to address needle fear. These innovative projects are helping to ensure Canadians have access to reliable information on COVID-19 vaccines and vaccination. Our partnership with Uber, announced last week, is also expanding access to critical information. To support increased vaccine uptake, the #MyWhy campaign launched earlier this month. It will continue throughout the vaccination rollout. This campaign asks people what's motivating them to get the COVID-19 vaccine and to share their reasons on social media channels. I encourage people everywhere in Canada to take part in this initiative. Your story may compel someone else to get vaccinated and share their story, further protecting our communities and spreading the word about the importance of vaccination. If you still have questions about the COVID vaccines, don't wait. Turn to a trusted source, such as your healthcare provider, so that you can make an informed decision about getting vaccinated when your turn comes, which may be very soon. Thank you. I will now invite Major General Fortin and then Dr. Wong to deliver their remarks.
Merci beaucoup, Dr. Njoo. Good afternoon, everyone. To date, we have distributed over 15 million vaccines of all types to provinces and territories. Yesterday, we completed the distribution of 1 million doses of Pfizer-BioNTech, and this week's distribution of 65,000 doses of Moderna is in progress. We also received 300,000 doses of the Janssen vaccine earlier this week. Vaccines arrived last night. They will go through a thawing process and be prepared for use. Once shipments are repackaged, deliveries will start to provinces, and this is expected at the beginning of next week. As with other vaccines, the allocation for Janssen to provinces and territories will be on a per capita basis, maximizing national impact and ensuring equity. Now, starting next week, We are set to receive 2 million doses weekly from Pfizer-BioNTech. In June, this is expected to increase to 2.4 million doses a week. For this quarter, it will bring the total expected of Pfizer-BioNTech doses to more than 24 million. The next Moderna shipment is expected to be slightly more than 1 million, and we're planning on distributing to provinces and territories over the course of the week of May 10th. Discussions are ongoing with Moderna to regulate its delivery process by determining a predictable level of supply, repeatable at an increased frequency, so that planners can build immunization plans with confidence. We'll communicate quantities and schedule to provinces and territories as soon as we confirm up details. Despite the recent reduction in delays, Moderna intends to come as close as possible to the 12.3 million doses objective for this quarter. We'll provide additional updates as they become available on that in that regards. In closing, the ramping up of the vaccine rollout continues with the arrival in country of another vaccine. We'll see at least 2 million a week moving forward. And this allows more and more Canadians to get vaccinated quickly and efficiently. Bonjour à tous et à toutes.
Good afternoon, everyone. To date, we have distributed nearly 15 million doses of all authorized COVID-19 vaccines to provinces and territories. Yesterday, we completed the distribution of 1 million doses of Pfizer-BioNTech, and this week's distribution of 650,000 Moderna doses is in progress. We also received 300,000 doses of the Janssen vaccine this week. The vaccines arrived last night. They'll go through a thawing process and be prepared for use. Once shipments are repackaged, deliveries will start to provinces and territories. That's expected at the beginning of next week. As with the other vaccines, the allocation for Janssen to provinces and territories will be on a per capita basis, maximizing national impact and ensuring equity. Now, starting next week, we are set to receive 2 million doses weekly from Pfizer-BioNTech. In June, this is expected to increase to 2.4 million doses per week. For this quarter, it will bring the total expected Pfizer-BioNTech doses to more than 24 million. The next Moderna shipment is expected to be slightly more than 1 million doses. We're planning on distributing them to the provinces and territories over the course of the week of May 10th. Discussions are ongoing with Moderna to regulate its delivery process by determining a predictable level of supply, which would be repeatable at an increased frequency, so that planners can build their immunization plans with confidence. We will communicate quantities and the schedule to provinces and territories as soon as we confirm up the details. Despite the recent reduction and delays, Moderna intends to come as close as possible to the 12.3 million dose objective for this quarter. We'll provide additional updates when they become available. In closing, the ramping up of the vaccine rollout continues with the arrival in the country of another vaccine. We will see at least 2 million doses per week moving forward. This will allow more and more Canadians to become vaccinated quickly and efficiently. Thank you, and I'll hand the floor over to my colleague.
Je tiens à reconnaître que je me trouve sur le territoire.
I'd like to say that I am on the unceded Algonquin territory. The current confirmed positive COVID-19 cases in First Nations communities is at its lowest level since the month of November 2020.
Today, I can share that COVID active case rates in First Nations communities on reserve is at the lowest since last November. This is attributed to the tremendous efforts of Indigenous leaders, frontline workers, successful vaccine campaigns in Indigenous communities across Canada, as well as other strict public health measures in place. As of April 27th, a total of 366,418 doses of vaccines have been administered in 661 communities, with close to 60% of adults in First Nations communities as well as over 70% of adults living in the territories who have received at least one dose of a COVID-19 vaccine. In addition to Northern Indigenous communities, I want to highlight that there are many vaccination campaigns for urban Indigenous populations across Canada. In Halifax, Montreal, Toronto, Ottawa, Hamilton, North Bay, Sudbury, Thunder Bay, Winnipeg, Brandon, Portage, Thompson, Regina, Prince Albert, Calgary, Edmonton, and Vancouver, to name just a few. The Métis Nation of Saskatchewan organized a 2-day vaccination clinic in Saskatoon last week, where they vaccinated close to 300 urban Métis members. These are just some examples of the truly remarkable efforts of First Nations, Inuit, and Métis partners to offer vaccines to as many as possible to help turn the COVID-19 pandemic around. Miigwech, Nakumik, Merci, thank you, and merci.
We will now open the phone lines to questions. We ask that you limit yourself to one question and only one follow-up. We will be taking your questions in both official languages. Nous vous demandons de vous limiter à une question et seulement une question suivie. Vous pouvez poser vos questions dans l'une ou l'autre des langues officielles. We will start with the first question. Première question, opérateur.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de David Thurton, CBC News. Please go ahead, à vous la parole.
Hi, thanks for taking our questions. Ontario and Quebec have announced today that their timelines for everyone over the age of 18 to book a vaccination appointment. So I'm just wondering, what's changed in your messaging to the provinces that has allowed them to, flip the switch and, release shorter timelines so that, more Canadians could get vaccinated?
Yeah, it's General Fortin here. I think what's changed is the massive increase in vaccines in the next few weeks. Provinces had been planning on a significant increase in vaccines June onwards. That's been accelerated as previously announced. And so if you look at what we have received to date and distributed, which is approximately 15 million doses since we started in December, what you will see between now and the first week of June is about the same amount. So it's a significant increase in provinces and territories, vaccines that arrive on schedule at a pace, and provinces are now able to plan better with more certainty, with more confidence, their immunization plans, and the same with the territories that have been receiving a steady flow of vaccines.
So today we heard from Ontario and Quebec moving forward their timelines for people under 18. When do you anticipate, Major General Fortin, when do you anticipate other provinces will be able to open up vaccinations to all adults?
Well, my colleagues and I are in constant conversation with provinces, as well as CPHO and Dr. Tam, Dr. Njoo, and others at various tables. And we constantly hear the different perspectives from the provinces and territories. There are pilot programs with more pharmacies, more modalities, drive-through clinics in Saskatchewan, walk-in clinics in different provinces. Most provinces are exploring new modalities and ways to distribute even more through more locations the different vaccines that are coming online. I think the provinces would have to make those comments at this point. Wouldn't want to speak on their behalf, but just the number of vaccines that are being made available to provinces and territories in the coming weeks will allow them to adjust their plans and share that with us.
Merci beaucoup. Prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque de la Presse canadienne. Please go ahead, à vous la parole.
Oui, bonjour à vous tous.
Yes, hello everyone. First question is for Dr. Njoo. I'm wondering if you have any recommendations to make with regard to who should be receiving the Johnson & Johnson doses. Should the provinces, for example, keep them for essential workers or send them to hotspots? Would that be a recommendation you would make? Answer. Thank you very much for the question. I know that everybody is waiting impatiently. The National Advisory Committee on Immunization is currently analyzing the Johnson & Johnson data. I think that very soon this advisory committee will be issuing a declaration. After that, it's really up to the provinces and territories to decide, based on the NACI's recommendations, to decide where to how to integrate these vaccines into their immunization program. We have very good conversations with our provincial and territorial counterparts today as well. And this will offer us another vaccine in our portfolio, the Johnson & Johnson vaccine. According to the manufacturer, this vaccine requires only one dose.
Par les programmes de vaccination dans les provinces et territoires, mais je pense que la première étape, c'est attendre les recommandations de CCNI, puis après on continue nos discussions
listening to what the NACI has to say, and then the provinces and territories will be able to decide. Follow-up question. I understood the NACI was independent, but I wondered about what you, the Public Health Agency, would recommend. I have a more personal question for Major General Danny Fortin, for you, Dr. Njoo. You've been speaking to us now for months and months in these press conferences. All of a sudden, Ontario and Quebec have announced today that they'll begin to vaccinate the general population. How does that make you feel, knowing that all Canadians will now be able to undergo mass vaccination? Maybe you can both answer this question. How does this make you feel, this good news? Answer. Well, I'll start by answering the last question. I have expertise. I have my own areas of expertise, but obviously I don't know everything about all areas of medicine as an expert. So I'm waiting to hear what the advisory committee says. That's exactly what the provinces and territories are doing as well. They're waiting to hear what their recommendations are. The provinces and territories have their own public health perspectives and operations, and they will integrate those recommendations to suit their own context. Now, for your second question, I can't say how Major General Fortin feels, but I think this is great news. We've been waiting months now for this news. We knew that the first quarter would have a limited number of vaccines to distribute. We nonetheless exceeded that number, and now we have millions and millions of doses, a new vaccine coming to Canada. This is nothing but good news. And I think our partners in the provinces and territories are equally as joyful to hear this good news. But I personally can now encourage my children, my own children, to get vaccinated.
Parce que pour ma part, je suis très fier de faire partie de
Major General Fortin.
Cette aventure.
I could say that I'm very proud of this adventure that we're on. I'm thinking of the thousands of people here in Canada who work in the various departments and agencies, provincially, territorially. the Indigenous agencies as well. They've been working so hard for this. I think it's a bit too early to celebrate. There's still a lot of work that we have to do to reach the point. This is Dr. Njoo. And I think we could also say, yes, this is great news, but of course we can't stop following the public health advisory instructions and guidelines. There's still much to be done individually and as a population. Thank you very much.
Thank you. Merci. The next question is from La prochaine question est de Dylan Robertson de Winnipeg Free Press. Please go ahead. À vous la parole.
Hi, Dr. Njoo. North Dakota is now offering vaccinations to Manitoba teachers, and the Manitoba Premier says that these teachers don't have to quarantine if they cross the border to get the shots and immediately return. I'm wondering from the public health perspective if it's safe to have teachers crossing an international border for vaccines, and what it says that, provinces are leaning on Americans to immunize essential workers.
Well, all I can say is from a public health perspective, certainly we're all aware of the NACI recommendations, which laid out the priority groups, obviously starting with our elderly and healthcare workers, people on the front lines. And as we move down, certainly essential workers, and I would say certainly teachers play a very important role in our society, would be among those groups. But just as we answered with the previous question, we're anticipating getting many millions of doses into the country, and obviously a large, obviously on a per capita basis, many of those doses are going to Manitoba and Manitobans, and so certainly our understanding expectation is that the Manitoba officials are looking at their vaccination program will be planning to actually administer the vaccines to Manitobans in the most effective manner possible, according to obviously local considerations such as our epidemiology. That's all I can say at this point. And as I said as well, it's important as we roll out vaccines to continue following public health measures. So certainly one of the things that everyone's been saying is that limit your movement, your mobility, stay at home if possible. So that's all I'll say on that in terms of, stay at home, wait your turn. And I think certainly the doses are coming. And I think just as was mentioned before with other provinces, also lowering the age and making it available to many more Canadians, I anticipate the same situation applies to Manitoba. Thank you.
Thank you. And my follow-up is for Major General Fortin. The Manitoba Premier says he's had to rely on the generosity of Americans because Canada's slow procurement of vaccines. I'm wondering if that's a fair comment.
Well, all I could tell you is that the numbers increase. And next week, Manitoba, for instance, can expect to receive 73,000 Pfizer vaccines, and more in the following weeks as Moderna starts arriving on a steady pace. So while the doses may not have been sufficient to vaccinate at the pace that was expected earlier, we are getting far more than expected next month than we had originally anticipated for the month of May. So it will increase. More doses are coming, and I know that the Manitobans are doing a lot of great work optimizing the different distribution or the different immunization platforms and modalities to include the RBC Center in Winnipeg with a throughput of 5,000 doses a day. So that's it's quite remarkable.
Merci. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Estelle Côté-Sroca de Radio-Canada. Please go ahead. À vous la parole.
Estelle Côté from Radio-Canada.
Bonjour, j'ai une question concernant les vaccins de Johnson & Johnson.
I have a question on Johnson & Johnson vaccines that we have just been received. Where do these vaccines come from? Do they come from the U.S., from the emergent biofacturing biomanufacturing facility in Maryland? And if so, how can you guarantee that these vaccines are safe, given that this facility has had problems in the past? Answer?
Je peux peut-être répondre.
I can perhaps answer. We can't indicate where these vaccines were manufactured.
Santé Canada
Health Canada
régularise le vaccin et il pourrait probablement répondre
regulates
à
the
cette question,
vaccines and can respond to that question.
Merci.
Thank you.
This
is Major General Fortin. I can say that for reasons that I've explained many times since last December, we do not disclose certain details on our supply chain for obvious reasons. But I can assure you that the products that are arriving in Canada are safe and will be delivered as soon as possible. Follow-up question. I'd like to know what you do exactly to ensure that we haven't received vaccines that were supposed to be discarded. We know that there were real problems at that biomanufacturing facility, that many doses were thrown out. What process do you use to ensure that these vaccines that we've just received are not ones that should have been discarded? How do we know that these vaccines are safe? Answer. This is Dr. Njoo speaking. What I can tell you right now is that our colleagues at Health Canada have approval processes. There are not just there's not only the data and the clinical trials that examine risks and benefits of vaccines. The Health Canada also looks at the entire manufacturing process in order to approve a vaccine for use. So we'll be starting the delivery of these vaccines. And perhaps we'll have more details from Health Canada later.
Merci beaucoup. Prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Mackenzie Gray, CTV News. Please go ahead. À vous la parole.
Hey there. My first question is for Major General Fortin on Moderna. In the previous shipment that was delayed by a week, you've been saying consistently for the full period of time that they were coming every 2 weeks. So kind of by the calculations I had, we were expecting a Moderna shipment come next week in the first week of May. You're saying it's going to be delayed a week. So can we expect that every subsequent shipment will kind of be pushed back a week, or is Moderna committed to meeting what their original schedule was that you had outlined before?
Thank you, Mackenzie. Moderna moved from a 3-week schedule to a 2-week schedule, and experienced some challenges with the quality assurance processes in terms of backlog, and they assure us now that they're coming out of this strong. They've increased their production. They're aiming to provide as many doses as possible, up to the 12.3 that they had committed to for this quarter. And over the next 9 weeks, this would mean, if you even it out, about 1 million a week. And starting the week of May 10th, we will deliver 1 million, just a little over 1 million that week. And we're just nailing down the last detail to make sure that we have a good understanding of the flow and the rhythm. And I think next week I'll be in a better position to confirm what that looks like moving forward. But we're looking at increasing the frequency and have a predictable quantity on a regular basis so that we can plan, execute effectively the immunization plans at all levels.
Thanks, Mr. General Fortin. My follow-up is for Dr. Njoo. I want to just go back to what you and Dr. Tam talked about on Friday with the modeling. There's been a lot of talk about the 75% of Canadians being vaccinated plus a 20% being fully vaccinated means that restrictions can be lifted. Dr. Njoo, can you give us an outline of when you talk about restrictions being lifted, what kind of restrictions would be able to come up at that point in time?
Well, thank you very much for the question, Mackenzie. Maybe I'll just go back to what Dr. Tam and I presented. I think it was Friday. As part of modeling, we put these figures forward, but as you hopefully have noted at the bottom of that slide, there are a lot of caveats, a lot of underlying assumptions, hypotheses, depending on what happens with variants, with sort of ongoing transmission, et cetera, and so on. So I think it is good, though, because we are discussing with our provincial and territorial partners to have a sort of that aspirational goal that say, hey, based on the projections of what we know at this point in time, if 75% of Canadians have received their first dose and 20% have received their second dose, then certainly also looking at the indicators, as I said, it's not just the vaccine coverage alone, but it's also looking at the indicators. What is the epidemiological situation? What is the rate of hospitalization and so on? That would help determine officials. And I would say really at a local level, I don't think you can generalize for a whole province, because just for example, for the province of Ontario, the situation, let's say in the Metro Toronto area, could be completely different compared to, let's say, Northern Ontario. But having said that, I think that based on having that vaccine coverage with the 1 and 2 doses, and then looking at those epidemiological indicators, I think the types of restrictions I think that could be looked at obviously would be maybe encouraging more sort of outdoor gatherings in terms of maybe people being able to get together and so on and so forth. I can't really say and predict because to be honest, I don't want to say something that gives sort of a false hope or expectation for something that may not turn out to be, exactly what the situation may be when we reach that target. But certainly, I think that we'll have to follow it closely. And certainly, I think I would say that we talked about the 20% for the 2 doses, right? But I think really, aspirationally, I think what we're all aiming for is to have all Canadians be offered, quote, the 2 doses. So ultimately, I think it'd be looking hopefully to having all Canadians have the 2 doses, not just sort of stopping at 20% of Canadians receiving that 1 dose. Thank you.
Thank you. Next question, please. Prochaine question.
Thank you. Merci. The next question is from La prochaine question est de Mia Robson, the Canadian Press. Please go ahead. À vous la parole.
Hi, good afternoon, Dr. Njoo. I noticed the numbers that you presented today in terms of how many seniors over the age of 70 in particular have been vaccinated, that they seem to be much higher than the typical number of seniors who get vaccinated for the flu. And I'm just wondering if you could, talk a little bit about maybe why the uptake of the vaccine has been higher than it is for the flu, and if we're seeing that in other populations as well.
Thank you. That's a great question. I don't want to speculate too much. I certainly have my own sort of personal thinking on this. I think to start off, I think we've all recognized with this global pandemic, COVID-19, that if you look simply at the morbidity, mortality, how serious a disease COVID-19 has been obviously for the past year, and even now more so maybe with the variants coming, and we're seeing younger groups impacted, that I think many people, obviously including our seniors who were hard hit in the first and second waves, recognize how important it is to be vaccinated. Not to take away from the flu, but I would say that maybe historically people in general, their uptake or acceptance of the flu vaccine compared to sort of, what many people might have thought would be, okay, it's a relatively mild disease for many, and maybe it's, for whatever reason they didn't take the flu vaccine. Hopefully, seeing the positive impacts that the COVID-19 vaccination has had, I would hopefully anticipate that there's what you call a sort of a knock-on or spillover effect, that people recognize that for the flu or for lots of other vaccine-preventable diseases, vaccination really is one of the most important public health tools. So looking forward to hopefully this being an enduring sort of legacy in terms of people's attitudes towards vaccination in general. And of course, as he said, with Immunization Awareness Week and so on, hopefully this is also another opportunity to celebrate and recognize the importance of a vaccination. So I think I'll leave it at that. And all I can say is that we're seeing the fruits of the vaccination with the seniors, and hopefully others will see that it's important that they also take the vaccine as soon as it becomes available and offer to them. And moving forward, hopefully in the future years, people also take up the flu vaccine, on a more sort of regular basis as well. Thank you.
And a couple of weeks ago, the CDC released data in the United States about the number of people who were vaccinated who had still come down with COVID, as well as getting seriously ill or dying from it. Is Canada keeping those statistics, and when might we see some of that kind of data in Canada?
Well, obviously, statistics or data like that are being collected at the provincial and territorial level. So we are in close discussions with them in terms of obviously rolling up that kind of important information up to the federal or national level. We've had some good, I would say, presentations, reports on cases that develop after a sort of a vaccination. It's important to note, I think, that people are making the distinction between, cases that might occur within, quote, the first 14 days post-vaccination. I think most people understand that it takes, at least sort of the 2 weeks to develop immunity, or at least a certain level of protection following that first dose. And so I think the analysis is more important to look at what cases develop, sort of after the 2 weeks post-vaccination. The other point also would be interesting to look at is that certainly as more and more of the population gets vaccinated, there's also the aspect that, as we know, no vaccine is 100% effective. So even if 80% after one dose, or let's say, for example, 90% protection after 2 doses, if you take it at a high population level with millions and millions of Canadians being vaccinated, certainly, we do anticipate that there will be cases occurring just because of the fact that the vaccine effectiveness is not 100%. So that's something to look at. And of course, I know the provinces and territories and ourselves at the federal level, we're also looking very closely in terms of cases that do develop post-vaccination. We're looking for something called vaccine escape, especially looking in terms of the variants. Are the variants having any impact in terms of the effectiveness of the vaccine? So there are lots of, I think, important questions, and we're actively at all levels of government and certainly at a local level as well, collecting the data. We'll do the analysis, and hopefully at the appropriate time, in a timely fashion, we'll be able to present something to you. Thank you.
La prochaine question sera la dernière. The next question will be the last question.
Thank you. Merci. The last question is from, la dernière question est de Mélanie Marquis de La Presse. Please go ahead. À vous la parole.
Mélanie Marquis from La Presse newspaper.
Bonjour, ma question est pour le Major Général
My question is for Major Général Danny
Vous n'avez pas mentionné ce qui arrive avec le vaccin AstraZeneca. Il y a les exportations de l'Inde qui avaient été
happening with the AstraZeneca vaccine?
Shipments
from India have been suspended. There's mention of Biden shipping vaccines overseas and abroad. Could you please tell us what's happening with AstraZeneca? This is Joël Paquette. I'll answer your question. We are still working with AstraZeneca to receive a shipment for June. This is a bilateral agreement. There are also discussions underway at different levels with the U.S. to possibly receive doses earlier. Thank you.
Peut-être Major Général Fortin.
Perhaps Major General Fortin, you could add something. I don't know if your answer will be the same.
Ma question suivante, en fait,
and my follow-up question concerns Mr. O'Toole's statement this morning. He's asking Justin Trudeau to ensure that every Canadian receives a vaccine shot by the May 24th long weekend. Now, if I look at your delivery calendar, is this something that's possible?
Alors, pour la première question,
For the first question,
demander à mes collègues de répondre.
I was going to ask my colleague to answer anyway. As for the vaccine delivery schedule, 2 million doses will be coming from Pfizer. As of next week, by early June, we should have 15 million doses, all brands combined. And
avec ce qu'on a cette semaine. Je crois qu'on a maximisé
I think we have maximized the number of quantities we can receive and that can be administered or sent out at least in the next few weeks. I think by May 24th long weekend, we'll be in a very good situation nationally, but it's up to the provinces and territories to administer these doses. Now, I've said in the past that in many cases, the doses can arrive in a region, but they have to be distributed. If we're talking about remote regions or rural regions, you need extra time to roll these vaccines out. So by the third weekend of May, I think we'll have a large number of doses across the country, and we'll see if the provinces and territories are able to vaccinate the majority of their populations by then.
That will be all for today's technical briefing. C'est ce qui met fin au brefage technique pour aujourd'hui. Merci beaucoup d'avoir été avec nous.